A week of upheaval at the Centers for Disease Control and Prevention, CDC, has left the nation questioning the future of public health leadership. Here's what you need to know about the events that have shaken the agency. But here's where it gets controversial. When did the CDC's turmoil begin? It started Monday, when an all-staff meeting was abruptly canceled, signaling that something was seriously wrong. Let's break it down. 1. Susan Monarez, CDC Director, resigned amid fierce controversy. The CDC's longest-serving director, Susan Monarez, stepped down after just over a month in office. She was confirmed by the Senate in late July, sworn in on July 31st, and led the agency through a deadly shooting at its Atlanta headquarters on August 8. Her attorneys claimed she was targeted for refusing to comply with unscientific directives that undermined public health experts. A tense meeting with HHS Secretary Robert F. Kennedy Jr. last week allegedly set off the chain of events leading to her firing. Monarez's exit has sparked fierce debate. While the White House called it a firing, her legal team argued that the decision wasn't formally communicated to her. Due to the Senate confirmation process, critics say this reflects a broader clash between science and political ideology. 2. Jim O'Neill takes over as acting director. Kennedy appointed Jim O'Neill, a former HHS advisor, to lead the CDC. O'Neill previously worked under George W. Bush and later ran investment funds for tech billionaire Peter Thiel. He's been a vocal critic of the CDC during the pandemic and a strong advocate for libertarian policies, including the idea that people should be compensated for donating organs to increase supply. O'Neill's background raises questions. Unlike Monarez, who had a doctorate in microbiology, he has no medical training. This has drawn criticism from Dr. Deb Howry, the CDC's chief medical officer, who emphasized the importance of scientific expertise in managing public health crises. 3. More leaders resign in protest. Alongside Howry, two top CDC officials, Dr. Dimitri Daskalakis and Dr. Dan Jernigan, resigned this week. They argued that Kennedy's policies align with anti-science activists' views, forcing them to leave in protest. As one official put it, "This is our time to make a statement about the agency's direction." 4. CDC employees face chaos amid political shifts. The CDC's recent turmoil coincided with a deadly shooting at its Atlanta offices, where a gunman killed a police officer after expressing discontent with the mRNA vaccine. This followed Kennedy's decision to defund $500 million in mRNA research grants, a move that exacerbated tensions. The agency also shifted its focus solely to infectious diseases, abandoning efforts to address injuries and chronic illnesses, a change critics say lacks a clear plan for the future. 5. Congress is now watching closely. The Senate Help Committee, chaired by Republican Senator Bill Cassidy, is investigating the CDC's leadership shakeup. Cassidy, a physician, once criticized unvaccinated children's health risks during Kennedy's confirmation hearing. He now wants to oversee the resignations and has called for a postponed vaccine advisory committee meeting, as Kennedy replaced the panel with his own members lacking the same expertise. The debate over the CDC's future is far from over. As the agency grapples with internal conflict, the question remains, is science still the priority, or is political ideology taking center stage? What do you think? Share your thoughts in the comments below.